When I watched your TED Talk, I was kind of shocked, actually. And the big revelation is that the third leading cause of death in the United States is actually medical error.
Yeah, talking of shocking, I was a nurse for 30 years already when I started researching this topic because we get to choose for our master's. And then carried that through into my doctoral research. But I was like, how come I didn't know this? How come I'm in this industry, but we don't talk about it? And so the shock of that was the part of me that said, what can we do differently? So that's when I started teaching the nursing students this concept called failure to rescue, which is watching for those signs of a patient becoming unstable. Because those signs happen, the literature tells us, 6 to 24 hours prior to an unplanned cardiac arrest. And so that's plenty of time, I think, for nurses or doctors or anyone, patients' families even being tuned into what those physiological signs are. So that was kind of the beginning of this whole journey for the last 16 years.
Welcome to Linda's Corner, where we bring more hope, healing, and happiness to the world. My name is Linda Bjork, and today we're going to be talking about taking charge of our own healthcare. I'm delighted to welcome Dr. Julie Siemers. Dr. Siemers is a patient safety consultant, industry nurse leader, and educator. She is also a TEDx speaker, author, and the founder of Lifebeat Solutions. You can reach Dr. Siemers at her website, lifebeatsolutions.com, and I'll include that link in the show notes. Welcome, Julie. I'm so glad that you could join with me today.
Thank you for having me. I'm really excited to talk to you and your audience.
Thank you. And I am so excited to be able to learn what you have to share because this information is so important. In fact, when I watched your TED Talk, I was kind of shocked, actually. And I thought, whoa, this is important. And this is information we don't hear all the time. And the big revelation is that the third leading cause of death in the United States, behind heart disease, behind cancer, the next one is actually medical error.
Yeah.
And that is terrifying. And it's, I think, a surprise to everyone because I have friends who are doctors. My daughter is a nurse. Every person who is in this profession is trying to help. And every person who is going to a hospital is trying to be helped. So the fact that we can be in danger is really disturbing. So, can you help us so that we can be safe?
Yeah, talking of shocking, I was a nurse for 30 years already when I started researching this topic because we get to choose for our master's. And then carried that through into my doctoral research. But I was like, how come I didn't know this? How come I'm in this industry, but we don't talk about it? And so the shock of that was the part of me that said, what can we do differently? So that's when I started teaching the nursing students this concept called failure to rescue, which is watching for those signs of a patient becoming unstable. Because those signs happen, the literature tells us, 6 to 24 hours prior to an unplanned cardiac arrest. And so that's plenty of time, I think, for nurses or doctors or anyone, patients' families even being tuned into what those physiological signs are. So that was kind of the beginning of this whole journey for the last 16 years.
Oh, okay. So you're talking about the title here is Failure to Rescue. And this is approaching, let's talk to the nurses, let's talk to the doctors, and let's fix it on this end. And your TEDx talk was more on the patient end. It's like, okay, what can you do? So I love that you are covering all of the bases, and I hope we can talk about all of them. But since probably the majority of our listeners will be those who are attending the hospital as a patient, I kind of like to go over your cuss words. Is it okay if we start there?
Sure, absolutely. And you're right. I mean, what we need to do to change this culture and really impact this crisis is to empower patients and their families, inform, educate, and empower. And so, yes, the CUS framework is the tools that you would use when you're in the hospital situation with your loved one, or even yourself as a patient, when the C is concerned, the U is uncomfortable, the first S is scared, or it's a safety issue. So, for example, if your husband just had surgery and he's not acting like himself, and you're concerned because you sense something's wrong, and you communicate that, I'm concerned that my husband isn't acting like himself. And so those words, concerned, uncomfortable, scared, and safety issue, are supposed to be kind of a warning system to the healthcare providers. And that's how we create a bridge, is we speak up. And yes, I know, as lay people, as we call it, you don't have the language, you don't have the education. But, and again, that's why I wrote my book, is to help people understand the hospital environment and protocols and what should you expect, because we just don't know, right?
I really appreciate that. You're giving permission to the patient to say it is okay to speak up. It is very common, I think, when we put ourselves as a patient in a hospital, that we turn over everything to those people who are trained and say, I trust that you know what you're doing. And we really do have to trust that people know what they're doing. But we do know us. And when we can speak up and say, this is what's normal for me or for my loved one here, and this is not normal. Because even though our doctors and nurses know protocols and procedures, they don't know our normal baseline.
Right.
So those kinds of things are very helpful. In fact, I had some friends who recently, their beautiful daughter had brain surgery,
Mm.
and her pain level, as a very quiet, very shy little petite little child, she just had tears running down her face. And to just watch her, you might think, well, she's not complaining, she's not yelling, she's not speaking up, she's fine. But for her parents who knew her, they said, wow, this is not normal for her. Her pain level is at least at a 7. And it took some effort because they didn't believe her, because the signs were not, I mean, they looked like she was just crying. I mean, quietly, discreetly, little tears coming down.
Yeah, you make a really good point. Um, when we do speak up and say you're not heard in the way you want to be heard, there is a chain of command in the hospital. And I think that's really important to talk about too, is if you tell the nurse and you don't feel like you're getting resolution or intervention or action, you escalate to the charge nurse. And then there is a nursing supervisor, a house supervisor. There's the chief of medical staff for doctors. And then there's the administrator on call, the hospital administrator. If it's evenings or weekends, there's 24/7 coverage. And so even though you may not be able to articulate what is wrong, running it up the flagpole, so to speak, is really important. And I know it takes courage, but here's what I would say. Think about if you didn't speak up and a bad outcome happened. And you're right. We as healthcare providers, from this end of it, we want to help. That's what we signed up for when we went to years of school. But when we talk about medical error, there are so many ways for things to slip through the cracks. And that's where I think the family can come in as partners. So it's just not failing to recognize, the patient's respiratory rate is too fast or their blood pressure's too low. But it's also the really important parts of being an advocate for your loved one is to ask questions. For example, and I've used this one before, but it hits home. Just ask, what is that medication you're giving to my mother? And the nurse, will reply, well, for example, this is her blood thinner. She had knee surgery. Oh, well, how many times are you supposed to give the blood thinner? Because the nurse already gave it 3 hours ago, or something similar. And then the nurse should say, oh, let me check. It wasn't charted. And that's just a common way that things can fall through the cracks, but can have harmful outcomes. We don't want to double dose anybody on a blood thinner, right?
No, absolutely not. There was a word that you used that I really loved, and that was partner. And
Mhm.
I think if we can come in and feeling like we are partners, that we're on the same team trying to do something. One of my, I guess, little fears as we try to speak up is sometimes we become adversarial and feel like, oh, you don't know what you're doing, or you're not in my best interest. And I don't think that's helpful. Do you?
Not at all. In fact, another tip I can share is the three P's. It's be present, be polite, but also be persistent. And so if you phrase your comment or question in the tone of curious, it will probably level instead of sounding adversarial. But regardless, there are going to be doctors and nurses or whoever, respiratory therapists, that don't want to be questioned at all. But that's their role, that's their job. And I believe, as patients and families, that we've got to be the one that changes the culture. If we start speaking up, then they're going to expect it. You won't be the oddball. You'll be one of, everybody that's fortunate enough to have an advocate for them, a loved one, speak up.
I love that. Okay, so we're coming with the approach of I'm going to be curious. I'm going to ask some questions. It is true. I don't have all this training. I don't know what all these things are. So let's get informed. And I'm going to ask some questions and maybe some follow-up questions. And if something doesn't feel right, I'm going to speak up again. But in the meantime, I'm winning because I am becoming more informed about the situation. And I think when we're more informed, it becomes a little less scary.
Absolutely. And that's why I recommend don't wait until you're in a vulnerable position of having to go through surgery or having to be admitted to the hospital for, a stroke or a heart attack or an accident, but really start to understand your own body, whether it's medications, what are they supposed to do? You can't just say, well, it's my heart pill. What is that supposed to do? Because if it's for cholesterol, hmm, maybe there's another alternative because cholesterol medications do have side effects. And it really is being an active participant in your own health and your family too, your husband, your wife, your kids. It really should be a family affair. So I say get informed prior to. Unfortunately, I think all of us are either going to be a patient or a patient's family member at some point in the healthcare system.
Absolutely. Well, that's a good reminder. So everybody listening, this is for you and me because it's if it's not today, if it wasn't last week, it could be tomorrow or next week or next year. We all have this opportunity because our health, I mean, it doesn't work perfectly all the time and we need some assistance. I love the phrase you used of active participant. I think that that's another pitfall that sometimes we get when we step in. It's like I'm the doll, I'm the mannequin, I'm the whatever, and you just do things to me without recognizing, no, this is a participant. Even if it comes to medication,
Right.
we have to take the medication. That requires some action on our part.
Yes. And understanding is crucial. It really, truly is.
Wow. Okay. So I'm thinking about the presentation where the words you're using, I think to help people become aware. We have the book is called Surviving Your Hospital Stay, and your TED Talk was How Not to Die in a Hospital. And I think hopefully that's a wake-up call to how serious and important it is for us to wake up and to participate, to become partners, to not just leave it in someone else's hand.
Right. And be passive.
And be passive. Right. So can you teach us some more? What do we need to do besides watch your TED Talk and read the book? And how do I keep safe?
Awareness is number one. So I think that's what I was trying to accomplish with both writing that book and then giving the TEDx talk, because as you said, nobody hears about this. It's not frontline news. And I always compare it to the airline industry. So if we talk about medical error being the third leading cause of death, what you'll find in the literature when you do research is they estimate about 250,000 patients every year. So if you look at that and divide it out by the day, I think 664, if I did the math right, patients every day across the country die of a preventable medical error or mistake. And if we look at the airline industry, it's always shocking, right? Back in January, when the military helicopter crashed right here in my backyard in Washington, D.C., and 67 people died, we're all shocked. And we should be. That's terrible. It's a tragedy. But if we compare the statistics, the airline industry, commercial airline, over 20 years have had 239 people die. 239 in 20 years compared to over 600 every day. So the awareness is really big. And I think that's empowering, knowing that we're not a perfect system at all. We as patient, as consumers of healthcare, we expect it, especially in this day and age where we have technology and, such advancements, which are wonderful. You would think, and this is what perplexed me for a long time, it still does to some degree, why is patient harm still happening? It really has been talked about in the literature for 70 years. Back in 1955, the Journal of American Medical Association said the most common thing that happens to patients in the hospital is harm. So why haven't we made progress? And I think, okay, so we need a different approach. The Einstein quote, you can't solve the problem with the same approach that made the problem to fix it. You've got to think differently. So that's what I'm trying to do is, bring in everyone on the team and do a huddle and say, how can we make this better?
Yeah, and that's what you're trying to do. So, when you're talking about 70 years is what we've been working on, and my brain is going back to the Hippocratic Oath, which is much longer than 70 years ago. That the first part is first do no harm, and then don't make it worse, and now let's try to make it better. And sometimes in that position of saying let's make it better, there's some pushback because people think, what do you mean? Do you mean I'm not already perfect? Do you not realize how much effort I put into this? And there can be some pushback. Have you had pushback, or are people on board? Are they happy with your efforts and what you're trying to do?
I've had some people say, why are you trying to throw your own profession under the bus? And I look at it from the perspective that every patient in that bed is someone's mother, father, sister, brother, and that we need to look at it that way because they are. Every person in that hospital bed is a human being that deserves the best care that we can give them. So instead of alienating the family by, saying, making them feel intimidated, which sometimes obviously isn't the intent, but it happens when they're in a hurry and kind of brush you off and leave. It's not the intent, but we need a new awareness. It's not just that patients die, but 1 in 4 patients at Medicare age, so in their 60s, suffer some kind of harm in the hospital. And if we expand the age group to be all inclusive, it's 1 in 10. And so not all of those errors they cause harm, but they don't necessarily kill a patient. But that's still just as bad to me. That's what we need to close that gap also. Communication breakdowns has been, I think we talked about this in the TEDx talk, is responsible for 70% of patient harm events. And that communication is always a two-way street. It's never one-sided, right? So for example, one other proactive thing that everyone here can do, if you have lab work, if you go in for a biopsy, any kind of diagnostics, take the responsibility to find out the test results. Don't assume because you don't hear back that everything's okay and everything's normal. Those kinds of things get lost in the cracks. I think that's one of the stories in my book. I talk about a man, 40-year-old man with a couple children, had a brain tumor. And after the surgery, he was told, and his wife, don't worry about it. It looked benign. So they didn't worry about it. But 6 months later, when he came back with headaches again and the same similar symptoms, and they found a tumor the size of the surgeon's fist. Then they found the original pathology report that said it was cancerous, but nobody notified the doctor, nobody notified the family. It just was one of those reports that got misfiled. So he didn't live, and he could have. There's a chance he could have.
That's so frustrating. Okay, so if I have lab work done, who do I call so that I can find it? I mean, it feels a little bit like a labyrinth of where do I find the information that I'm looking for? And
That's
will
a
they give it to me because I'm not a doctor, I'm just a person.
It's your patient bill of rights or one of your rights as a patient to have access to all of your health information. So there should be a patient portal. So you ask your doctor's office or the hospital, where are my results so I can look them up. Um, and if you're not getting the results, you just need to dig a little bit further. And I would ask AI. I know that a lot of people aren't comfortable with AI, but I'm telling you, the advancements in the last year, just ask the simple question, what are my rights as a patient in finding my own health results? And is there somewhere I can refer to, like who I call? Because it might be different for each health system or each different state, but AI is a huge help.
Fascinating. So that if I don't know where to go, that's a place that I can ask as the first step so that I know who to call. And then follow that and continue to say, okay, until I get the answers that I need. It
Yeah.
is very reassuring to know that we do have a Bill of Rights as a patient. And if we can, even just the word saying, is there a patient portal? Is there some place I can get my information? Because again, I think it needs to be approached in a way, as you mentioned before, that we are partners
Mhm.
and that we are working as a team
Yeah.
and that it's not adversarial, like, I haven't got my results yet. And blah, blah, blah. I imagine that there will be more kickback if you come in it as you didn't do your job than if you say, hey, I am looking for my results. Can you help me find them?
Yeah. I think the one other call out I would say is that healthcare today, it's a little chaotic and it shouldn't be, but it is. And providers are taking care of many patients. Sometimes they get things mixed up. We're human. But if we take our responsibility piece of it, and again, partner, I would think that would not threaten a provider, but say, oh, thank you for asking. Yes. And it really, to me, lightens the burden on the healthcare provider when you've got a family that's engaged and really wants to know what their options are, or, help me understand. It says my husband's bleeding time is too high and he's taken this medication. Is this something we're going to look at and adjust his medication? And that's an informed, intelligent question to ask the provider. And I think that is the one of the best ways to partner. And so, yes, you've got to do a little bit of your own homework.
Absolutely. And the questions really should be informed and intelligent and very proactive and
Mm.
curious. And that makes all the difference. When you're talking about the scope of the problem, and I love that you compared it to an airline industry where we have a big catastrophe, it focuses all of our attention and we see it. And sometimes it makes us afraid to get on a plane. And here we have a situation where it's not big, it's quiet, it's personal, it's individual. But for that individual and their family, it is absolutely catastrophic and it's a big deal. And when you talk about the scope, it feels systemic. Like we really need to make some basic changes. And in the process, before big changes, whatever they may be, are made, it's reassuring to know that there's something that we can do to help make sure that our story ends up positive. We're not helpless. And I think that's part of what you bring is, guys, help me. Help me to help yourselves because we need to make some changes.
Do. Thank you. Yes, I agree completely. Well said.
Wow, that's just, oh, terrifying. Okay, is there anything else you want to make sure that we cover today before we close?
You know, it sounds doom and dismal and negative, and it is. The statistics are not great, but I have hope. And sometimes that's where I think need something, a solution is born out of something has to change. Just like, back in the horse and buggy days, can we do something better? Right. And so it does take the will, um, and the collaboration. And that's what I have hope for. I really do have hope that the more informed every one of us become and the more empowered, because when you learn something, it's like, wow, I have now an option, and then you can talk about those options with your healthcare provider. So I have a lot of hope.
Oh, I'm so glad you have hope because you're in the know. And I think that hope is really the first step to be able to move forward. It's not, I'm just throwing my hands in my air. There's nothing we can do about it. This is terrible. It's, wow, I see a problem. And I see some places where we can make some solutions, particularly in the area of communication, which is something that both parties can participate in, which makes a difference. And I loved how you said, man, if we do this right, it lightens the burdens of our healthcare providers as people become more partners in their own situation. Because as we mentioned at the beginning, people who go through the education and all of the training to be in the healthcare profession are doing it because they want to help people. And yet, when we come to individuals, there is no person on this planet who cares more about my well being than I do and the well-being of my people. And so I bring in an extra level of care and concern for my situation and my people. So I think together we really can be a better team.
Yeah, I agree. Here's the thing too with healthcare providers. They have had an education 12 years, but they still are never going to know it all. Just like I've been a nurse 45 years, I will never know it all. There's so much new information, there's new technology, there's new medications. And so having a provider who has a lot of experience may not be up on the new technology or medications or whatever, but also then having a newer graduated doctor doesn't have the experience of listening and knowing things that work that maybe they learned over their long career that they didn't learn in medical school. And so that's where I think the kind of the conundrum is for, us as healthcare consumers, but just even understanding that medical knowledge used to be doubled every 3 years. And I think now it's down to under a year. It's crazy.
Whoa.
So yeah, again, that's where I think just doing a little bit of research and learning about your body, your condition, your medications, your disease processor. How do we stay healthy to stay out of the acute care? I think is the shift we need to see because it really, the way we practice, it's not really health care, it's really disease care.
Good point. Good
So if
point.
we can switch that and really take over our own, how do I stay mobile, as long as I can? How do I combat my sitting desk job? What do I need to do? What are the better food choices that can fuel my cells? So I think it's a revolution that has begun in that area, but staying out of acute care as long as you can is your best recipe for a good life, happy life, long life.
Wow, what an excellent point. And there's a similar thread throughout everything, and that is that we need to be proactive. And the best place to do it is to take care of ourselves to ensure that we stay healthy so that we don't require the assistance of a hospital or whatever kind of care. And then if we find ourselves there, we need to continue to be proactive and being able to still, and it's empowering, but for a lot of people, they really just want to delegate that. It's like, I am too busy. I'm too stressed. I'm overwhelmed. I don't want to deal with it. Can't somebody else deal with it? And the answer is yes, ish, but it's still you, and you're going to care more about your well-being than anybody. So there is no free pass of
Right.
just you don't have to worry about it because it's you.
Yeah.
Hmm.
And even well-intentioned, as we said before, and as you pointed out, is never going to be the same level of care and intensity that you have, for yourself or your loved ones.
No one's going to feel the consequences of me and my actions and my situation like I am.
Right.
So, wow, this is empowering and sobering. It is a wake up call. Guys, we're in charge of us, and there's no way around it. And when we delegate and enlist the help of professionals, which is awesome and wonderful, we still have to be partners. We can't just say, this is your problem. Just tell me what to do and I'll do it, because it doesn't turn out well. All right. Julie, thank you so much for visiting with me today. I really appreciate you, and I appreciate that you're advocating for all of us. And I hope that people who listen will join this cause and help, um, and that will be a win-win. It will strengthen your cause as well.
Thank you. I appreciate that. My intention is to save as many lives as I can. And the best way that I have grown to understand what that is how to do it is to spread the message of awareness and then educate in any way that I can.
And that's the purpose of our conversation today. You were amazing. Thank you. Thank you for what you're doing. I just appreciate it so much. And someone else could come up with this message and say it, but without your background, your skills, your education, your knowledge, um, it wouldn't fly. When you said, people say, why are you throwing your own profession under the bus? It's because you're the only one who can.
Thank you. Appreciate that.
So thank you for having the courage to, I don't know, be a team player with the world and not just a team player with the profession.
I appreciate that. I just feel this calling so strong in my heart. I think, that's what I've spent my life doing is building the knowledge and the experience, as you said, and the education. And I got tired of saying, how come someone's not doing anything? And the universe, I felt like just knocked and said, hello.
Yeah. Isn't that funny?
I
I
thought
know.
someone would step up.
And you are that someone. So thank you for,
You,
I
Linda.
mean, and you may never know how many lives you've saved, um, and will
That was
continue
awesome.
to save. Wouldn't it be wonderful if at some point in this life or hereafter, all the people came and said, thank you for what you did. I had 10 more years with my
Right.
children and my grandchildren because of your efforts.
That would be amazing. Thank you so much, Linda. Thank you for having me.
In closing, I'd like to share a quote by Margaret Mead. She said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Today, I invite our listeners to change our experience and the world by speaking up and advocating for ourselves. See you next time on Linda's Corner. Thanks for tuning in to Linda's Corner podcast. If you enjoyed this episode, please subscribe and share it with your friends to help us inspire even more listeners. Be sure to visit hopeforhealingfoundation.org for free and affordable resources to help you overcome life's challenges. And explore healingbreathworkdetox.com, where you'll find transformative tools for deep inner healing and lasting change. Also, don't forget to check out my books, Crushed, A Journey Through Depression, and You Got This, an action plan to calm fear, anxiety, worry, and stress. Your journey to hope, healing, and happiness starts here.